And what else can we do, right? And here's what I'll discuss next is our current racial demographics here. And so addressing physician race demographics, and this is a clever cartoon about the absence of African-American doctors. And this has to do with our pipeline, our education gap here in the United States. And anytime we talk about physician demographics, this is a difficult conversation in the United States, particularly with affirmative action and some other things, which I'll talk about briefly. I always like to highlight, let's bring up the data, right? You shouldn't have this conversation without knowing the data right there, right? Because the gravity of the conversation, the importance of the conversation is made so much more if you're having a discussion with somebody when they are both sharing the same data. So let's go through it. So on this chart, this was done in 2016, you can look at Hispanics, African Americans, and whites as the ones I'll focus on, and Hispanics being the yellow part of the graph, African Americans or Black people being the red part, which is 12.7%, and whites being 61.3% of the population, right? And if you look at 2050, which is our next one, you'll see that African Americans and Hispanics are going to greatly increase their size by 2050. So much so that whites will be, for the first time in the United States since we started recording these metrics, unfortunately, that they will be a minority if you combine all of their races combined here. So, but what does that reflect on our physician population? So physicians, African-American physicians make up only about 5.8% of our, African-Americans make up about 5.8% of our physicians in 2016, and about Hispanics make up about 3%, right? So a huge gap, greater than 50% decrease in what should be represented, right, in our physician demographics. And the question is, are we getting better, or is emergency medicine specifically the better? And this is something that I'd also like to highlight, is a lot of these specialties have to divide that 5.8% between their own ranks, right? And so that's 3.1% African Americans inside emergency medicine providers, which is unfortunate, because emergency medicine, a majority of, or a greater proportion of African Americans get their healthcare entirely through the emergency department than their white counterparts. They're more likely to engage in medicine through the emergency department than their white counterparts. And so this is a specialty that takes care of African American and minority populations, and yet we're underrepresented, even worse than the national average for physicians in our racial demographics. And we can keep going. How about in training? Are we getting better? This is resident physicians in 2017, and African Americans are only 5%. So if we started out even at this moment right now, we would invariably or inevitably end up having the same disparity we're looking at now, right? We're not training African American physicians at any rate to reach population parity. And somebody could argue, well, this is 2017, it must have improved from a couple decades ago. We're clearly improving, and the answer is no. In 1999, when the ACGME, which is the governing body for residents here in the United States, first started publishing data on racial demographics of our residents, emergency medicine residents were 6% Black and 4% Hispanic. So we're doing actually worse than we were 2 decades ago. And in that 2 decades, we've had our first African American president, we've had social media. And so what we're finding is that there is no potential for us reaching population parity at this point. Not only that, but we're not improving at all, right? We are exactly where we were 20 years ago. And I think that's something that people need to be made aware of, right? It is so difficult for physicians and people in higher education to understand this unless they're living these metrics and the recruitment process on their daily lives, right? And we can look at medical students as well. They're about 7 to 8%. And really what that means, this is actually a map I did in my last year of residency at the Mayo Clinic. And the Mayo Clinic is right here in Minnesota, where my mouse is. We like to say we're fairly Canadian. And I feel like I was very in tune with Canadian culture by living in Minnesota, but up in the north. And what I did as an African-American resident, I was the first one in our department, in the emergency department at Mayo Clinic. And Mayo Clinic is the #1 hospital in our country and the richest hospital in our country. And it's in a town that's very majority white. But what I found was I'm the only African-American in the department, and that's nurse practitioner, physician assistant, resident, or physician. And I was that for the whole 3 years of my training, except for another African-American female who was an intern when I was a third year. And so that means as an intern, 2 years above me, there were no African-American male residents. 2 years below me, none. That's half a decade, 5 years of training, but there were no African-Americans in that emergency department training. And that's in the entire city of Rochester. We're the only residency program, but then you can expand it. In Minnesota, all 3 programs in Minnesota had no African-American residents except for me. And then what I did was went ahead and called every program in every one of these states. And I was able to color the map as far as from going basically from Chicago, which is right here in the northern tip of Illinois, all the way to the Pacific coast. There is no African Americans that trained for the last half decade, African American men, that is, to specify, in the emergency department, right? And this is well over 1 million African Americans who will be seeking care inside these emergency settings. And so this is why that 3.1% really matters, right? And like what it represents. And to feel like a minority while you're in a setting is one thing, but then to discover that in a quarter of this country's geography, and if I wanted to, this is only limited by the fact that I stopped looking at other states and calling them because the data was sufficient for me to make the point. I could probably color this entire map with because a lot of these African-American physicians are centered in places like Houston, Los Angeles, and New York City. And so this is a huge problem in our country. And so methods to improve diversity in medicine. And I'm a huge believer and a proponent, or I strongly support affirmative action. It's a difficult conversation to have. It's been to our Supreme Court a number of times. It certainly disadvantages other minority groups that aren't underrepresented in medicine. And I'm fully on board with hearing the plight and making sure we're on the same page and discussing how this can impact them. But I still strongly support the idea that with those statistics, we need to somehow mitigate the disparities that we're seeing in the education gap. The other thing we've done is try and create a more holistic review process when we're trying to include people in a medical school, residency, and as physicians into their careers. And that's because we found bias in pretty much every single metric if you use the isolated. That's in standardized tests. Pretty much in every standardized test, there's been demonstrated disparities, racial disparities, to where African Americans and our Hispanic counterparts are doing poorer than our white counterparts, regardless of socioeconomic status and education. The AOA, which is our honor society, there's disparities there. There's disparities in the ability to seek out mentorship or research, which is another metric. And also just the disparities within the big name schools like Harvard, Mayo Clinic, which are a metric in themselves. Removing those and creating a holistic review is a way we attempted to mitigate some of these disparities. Another thing is to create pipeline programs, right? And this is a big problem our residency directors are having. If only 8% of medical students are African American, you're not going to get more than 12% of your residency class, which is population parity, into your class. And so the pipeline is broken way before you get to residency. And so there has to be ways in which we can engage our high school, college, medical students and just make sure they're staying on track through the pipeline, particularly with retention rates. Now, I'm not asking you to go out and create a pipeline program yourself, but if somebody within your practice or potentially you has this pipeline program or a student or a mentee, support it and give it financially support it, give it professional support and or even just your physical and your own support with your time and value. And so I strongly encourage those. I was part of both of these, the Tour for Diversity and the Summer Medical Dental Education Program. And then lastly, mentorship. And so this is a picture of Dr. Robinson. He's almost like a father figure to me. He's essentially a father figure. He was I went to Howard Medical School, which is a historically Black college and university, and he's the first Black man to ever interview me. And I was a Robinson man, and so he's one of the greatest mentors of my life. Greatly changed my life. He graduated the day he retired the day I graduated from medical school. And he's had such a profound impact on me in my education. And this to the right of him is Dr. Annie Sadowski. She was the chair of the emergency department at the Mayo Clinic when I was a resident, and now is the vice president of Mayo Clinic Minnesota Association. So a very powerful woman who self-reportedly was born of a silver spoon, self-admittedly, that is. Ophthalmology her father worked as an ophthalmologist. She went to Ivy League school at Brown, and she was my mentor throughout my residency and even now. And what I'd like to highlight is that she is a white woman from the East Coast who is from a different socioeconomic status from me and was able to go to an Ivy League institution. And she had a profound impact on me as a mentor. And I'd encourage all of you who may have opportunities to mentor a minority or underrepresented student or marginalized student, or even just a student that doesn't match you demographically, to lean into it and be as useful and capable or as you could possibly be and as much as requested. And if you're a mentee or have the opportunity for being a mentee, your mentor could come in all types of shapes and sizes, genders and everything. So I'd encourage mentorship in every setting. I wouldn't be where I am without it. And so these are basically ways in which we can improve our diversity. And so in conclusion, right, I kind of threw a lot at you guys here. One, we talked about defined a few terms, but really talked about the structural versus individual racism and our need to address both of them. But our mandate is to address the individual racism here. And we've seen it in so many variety of ways, so many different ways it seeps into our practice. And then and that has to do with subconscious bias, which we covered. And then we mentioned some interventions that can be used to address this. Anytime you have an ability to standardize your practice, I would encourage you to do so. And then also just in America, we'd like to improve our physician demographics and make that a huge priority for us. Every medical governing body has made that a priority for us. And hopefully these things can be replicated in Canadian society. And I have a strong belief that they will, especially as you guys are going through some of the growing pains and also sharing some of our social psyches of Black Lives Matter, the George Floyd incident of Ahmaud Arbery, the coronavirus. All this is bringing us to the forefront of our psyches and our consciousnesses, and hopefully you guys are able to apply that to yours as well. Thank you guys so much for having me. It is such a pleasure. I will open up the board to any questions here. I know I slammed a lot of information down and we went through it pretty quickly, but it's something I'm really passionate about. I wanted to make sure we had time for questions here. So I'm going to stop sharing here and go right back to you guys.